So today's lecture is what topic? Study design. Study design actually basic thing is epidemiological study. Part of what is study design? Scientific and technical ways and methods of searching to find out, try to find out. How can we try to find out? In a scientific and ethical ways. And we have to follow some process. Why? To harvest valid and reliable information. Valid and reliable information. So every word has a meaning. Objective of the lecture. I would expect you will be able to know the types of study design, scope of study design, at the same time the limitation of each study design. Okay? Type, scope, and limitation. Broadly, there are two different types of research design. So, since last 2 days, I am always talking about first we have to think about the broad. Yeah? Then becoming narrow down. So, broadly, there are two types of research. One is qualitative. Do you know qualitative? And another is quantitative. Qualitative means it is to explain something. And quantitative means quantify. It is always related to the number. Okay? So qualitative research is the method of information collection. Okay? That takes the form of measurement or number. Oh, okay. Quantitative. That's why. Firstly, it is the information that is collected in the form of measurement or numbers that can be analyzed statistically. It is always quantitative research. It's always related to the number. Okay? And we always need to take help, some statistical procedure to analyze our data. You have the data, you just calculate it? No. We have to follow some procedure. And in qualitative research, it always aims to understand the process that I told you. To explain something. Process. Which lie behind the pattern of behavior. People's emotion. Okay? Their responses to certain situations. Meaning that when we need to explain something, we always need help of qualitative research. If we want to look at the magnitude, if we want to look at the prevalence, incidence, some number, then we think about the quantitative research. Okay? If we want to explain something, okay, how is the people's behavior? It is very difficult to get information quantitatively because quantitative number gives you the number. People's behavior, you cannot measure it by number. Okay? And usually we use the non-statistical method for qualitative research analysis. Okay? This is broadly. Now the epidemiological side. This is the main thing for you. Okay? Study design. There are two. It is the quantitative study design. Now I am talking about the quantitative research design. Okay? There are two types. Firstly, there are two types. One is observational or non-interventional. Another is experimental or interventional. Okay? Observational study design again divided into descriptive and analytical. You can see here. Descriptive and analytical. Okay? And experimental study design again divided into randomized control trial, community intervention trial, and quasi-experimental design. You understand?
No.
Terminologies are very new, isn't it? For you? That's why difficult to understand. But when I explain everything one by one, then it will be easier for you. Okay? And under the descriptive, but today, actually, I will focus only on the observational research design. Okay? Because experimental is not as part of your course. So only the observational design I will discuss. So under observational design, there are two types. One is descriptive, one is analytical. Under descriptive, there are three types. One is cross-sectional, case report, case studies. Okay? Cross-sectional, case report, case studies. And under analytical, there are three types. Again, there are three types. One is case control study. Do you know? Have you ever heard about it? Case control study? No? Case control study, then comparative cross-section study. Actually the cross-section here also descriptive, but when we try to compare, we have the comparison group, then it becomes the comparative cross-section under the analytical research design. Okay? Another is cohort design. Cohort means always we try to find out the incidence. You know what is incidence? Prevalence is the number of both old and new cases. And incidence is only the number of new cases. Okay? But it will cover in another lecture. Don't worry. But this is very important for you. These two parts. Okay? I have many slides. I will go through the slides. If you do not understand, raise your hand and ask me the question. Okay? If you do not ask question, then I cannot understand. Where is the difficulties? Okay? Then what is the difference between? Because you know the observational study is divided into two. One is so this is the descriptive and this is the analytical, that part. Okay. So what is the difference between descriptive and analytical research design? Descriptive is very simply describes the disease occurrence with the general information. Only disease occurrence described. But in analytical design, it explains the disease occurrence. It describes, it explains. Okay? And it actually, the descriptive study is related to the distribution of the disease. What is the distribution? In which population that high drop it? What, when, who, place, then no, how and why always analytical. But it has in the slide also. I am coming. So, explain means how and why. When you want to look at the how and why, then you have to design for the analytical. And if you do not want to only describe which population is affected, which age group is, when the disease has occurred, and where the disease occurred, then you have to design for the cross-sectional, the descriptive study design. It's too hot. It's more diffuse and superficial. It's narrowed down to answer the specific question. More explanation is there. So So no attempt to analyze the link between exposure and outcome. So when we want to see the association between exposure variable and exposure mean, yesterday I talked about dependent and independent. Exposure mean independent variable. So if you want to look at the association between independent and dependent variable, then you have to design for the analytical. Okay? Because through descriptive study design it is not possible to look at the association. You understand? And descriptive study actually generate hypothesis, but analytical study design it tests hypothesis. These are the broad difference. Descriptive study design generate hypothesis, and analytical study design test hypothesis. Okay? Few things you need to remember. One is it generates hypothesis, it tests hypothesis. Another thing is it only describe the disease occurrence. It explains the disease occurrence. And it is not possible to see the association between exposure and outcome variable. But when you want to look at the outcome and exposure variable, association between exposure and outcome variable, you have to think about the analytical study design. Okay? Understand? Clear? So case study is under what category? Descriptive, isn't it? Case study. Usually case study collect the empirical data. Empirical means that you experienced, that a person experienced. Practically, if I am practically suffering from tuberculosis for a longer time, then you can take me as a cases for case study. Then I will explain what I am experiencing by myself. This is the case study. Okay? And generally from only one or a small number of cases. You can take one. There is no actual sample size calculation. But you have to have very detailed information. All information. Okay? In case study. You consider one case only in your study. But very detailed and nitty-gritty information should be there. It's too hot. And it provides the qualitative information. There is no quantification. Okay? Aims to provide insight into the particular situation and often stresses the experience and interpretation of those involved. That I explained to you. If I am suffering from tuberculosis for a long time, but your intention is to look at what is the quality of life if the patient, if anyone is suffering long-term tuberculosis, then you have to think about not any quantitative study. You can think about the case study. Okay? Again, it generates the hypothesis. That I told you, descriptive is, case study is under the descriptive and it generates hypothesis. Okay? And survey. This is also empirical. What does it mean by empirical? Experience. That you are practically experiencing. This is empirical. And theoretical is theory. It may or may not be related with the practice. Okay? This is theory. Standard. Empirical, what you are experiencing. Okay? So, survey is the empirical, this is also empirical study. But it involves collecting from a large number of cases. In case study, we include only one or few numbers. But it involves large number of cases. And you have to use questionnaire. For your mini research, I think many of you are thinking about survey. Okay, so this is survey. You have to use, when you have to involve large number of cases, you have to use the questionnaire and usually you have to quantify. Then it is called survey. Survey means you have to quantify number, related to the number. And you have to involve large number of cases. Okay? And survey may be cross-sectional and survey may be analytic, longitudinal. What is cross-sectional? I told you when you show the diagram of study design, under descriptive there are two types, isn't it? And one is descriptive, another is analytic. So it's like that actually. Cross-sectional under descriptive, okay, and longitudinal under analytical. I will discuss this later on. So cross-sectional survey may be cross-sectional. Cross-sectional when you collected data at one point in time. But longitudinal means you have to, for instance, one point in time means I think your mini research is going to consider the survey at one point in time. You just go to the field and ask the participants whether you are suffering, what is currently happening. And longitudinal means, for instance, 2008, then 2008 you have to start your study, then you have to follow up until 2012. For a long period of time. This is called longitudinal. You understand now? Cross-sectional means one point of time. And longitudinal, you have to follow up for a period of time. It's up to the disease pattern. If it is long latent period, then you have to consider long follow-up time. If it is short latent period, then you have to consider the short follow-up period. So it depends on it. There is no fixed time period. Understand? And that I told you, because of the large number of cases, I will always use the quantitative statistical procedure for analysis. Okay? So now the cross-sectional design. This is important for you. Please try to understand. If you do not understand anything, raise your hand and stop me and ask me questions. Okay? Cross-section. This is very important for you. Question is, you always have to think about, try to find out what is happening. Okay? What is happening mean? What is happening? It is which tense? Present tense. Present? There are many sort of present tense. What kind of present tense? Simple present tense, isn't it? Continuous. What is happening? Okay? And done in a sample at a particular point. That I told you, at a particular point in time. So you go to the field, you select a sample size. You have a class today at 2 o'clock. Dr. Jamal will take how to calculate the sample size. I asked him to take a class on that because many of you may need to calculate sample size in your mini research. That it is very important. So he will take a class today. So you are not going to consider all of the population, isn't it, in the community? This is not possible practically. So you have to consider a sample. Okay? So when cross-section study design usually done in a sample at a particular point in time. This is important. At a particular point in time. For instance, you are going to the for your mini research, you can plan for data collection in July for 1 week. This 1 week is particular point in time. Okay, you understand that? And actually, in the cross-sectional study design, we observe the exposure and outcomes continuously together. You understand? You do not understand? Because you are, what about the cross-sectional design? At a particular point in time, you will collect the data. So, at the same time, you are asking about the design, asking about the disease, also you are asking about the causes. You understand now? Yes. At the same time, you are trying to observe both exposure and causes. Okay? And also the disease simultaneously at a particular point in time. This is important. Three things. What is happening at a particular point in time, and you are observing both exposure and outcome simultaneously. Okay? Clear? Yes. Very basic. For example, here is an example. An obstetrician observed that spina bifida, it is a congenital anomaly. You know that? No. Because you are the clear one. It's the congenital abnormalities of the baby. Okay? Spina bifida is common among women who delivered at IIUM maternity hospital. Okay? So she want to study what is the prevalence of spina bifida who delivered at IIUM maternity hospital. What are the factors associated with the condition? So, in this sort of questions, you have to design for the cross-section studies. You understand? Yeah. Because many of you now you want to look at obesity, what are the factors, whether it is associated with fast food, whether it is associated with physical activities, okay? So these are the cross-section studies. When you aim to measure the prevalence, you always think about the cross-sectional studies. When you want to measure about the incidence of the disease, then always you have to think about the analytical studies. It's the basic thing. You understand? Understand? Yes. Who do not understand? Raise your hand. I will explain. No problem at all. And I think it is not the question of shame if you ask the question. It actually indicates you are intelligent enough. That's why you want to become more clear and clear. Okay? But we perceive, if we raise your hand, okay, it is shameful, people may consider me, I am not understanding. No, it is not like that. Students who are intelligent, they will ask more questions. Okay? It's too hot. So now, I told you, I like picture, I like diagram. Because it helps you to become more clear. So, if you selected this sample, this is the sample that you selected for your study. And actually, you select the sample, you initiated your study here. And simultaneously, you are observing what amount of population from this, what number of population is suffering from disease, what are suffering without disease. You understand? So, there is no direction of inquiry. Means, you are inquire about exposure and outcome simultaneously. There is no direction. But in longitudinal study design, you have to look forward for the cohort study. And case control, you have to look backward. I told you in the later slide. So you have to follow up, meaning that there is direction. I have started, select the sample, then I have to go forward. Isn't it direction? If I go in this way, then it is go backward, isn't it? But in cross-sectional studies, there is no direction of inquiry. Why? Because you are looking for both exposure and outcome simultaneously. You understand now? No. You do not understand.
Maybe you can do diagram on the.
This is the diagram. This is the diagram. Because there is no direction of inquiry. You just, it's a certain period of time. For instance, 1 week. So you are not observing the subject from disease, from exposure to disease occurrence. No. You understand? Mm-hmm. Yes. Oh, it's easy because you are the obstetrician want to look at the prevalence of spina bifida, isn't it? So who delivered at the IMM hospital during the month of February, for instance, of 2014. So she collected all cases on February. Okay, in February, who delivered? And she wanted to look at how many delivered with spina bifida. Okay, then she tried to find out the causes at the same time. She also looked at the women has some problem or not. That's why she delivered the congenital abnormality baby. So both exposure and outcome, she wanted to look simultaneously at the same time. You understand now? No? Not clear. If longitudinal study design, then I have the diagram later on for the longitudinal study. But for the cross-sectional, you have to understand 2 points you have to remember. One is no direction of inquiry. Another is what is happening. What is happening? And no direction of inquiry means you are looking for both exposure and outcome simultaneously. At the same time, there is no direction. You understand now? For instance, I am suffering from dengue fever. Okay, so you are, and at the same, people in Malaysia, in your village, they are suffering from dengue. So certainly, the Ministry of Health want to know how many people actually suffering from. So there you want to design a study. And you want to, and why they are suffering from dengue fever. So you go to the village and take a sample and wanted to look at both how many population are suffering from dengue fever and at the same time to look at the causes. But if you at first take the sample and follow them up, okay, how many are smoking, how many are not smoking, I select in this way, then I follow up, and after 5 years I want to look at how many is suffering from lung cancer. Then it's longitudinal. You understand? You understand now? So this is very important. So take a sample, then you inquire the sample and you find some people is suffering from disease and some people without. Okay? You understand now?
Yes.
Clear?
Yes.
So what is the advantage of cross-sectional study design? It is easy to carry out the research, this sort of research, because it is quick and inexpensive, not very expensive. You can study several exposure and outcome at one point in time. It provides the prevalence information and may provide clue that I already told you. It generates hypothesis. 3 points you have to remember. I emphasize. One is cross-sectional study design. 3 things.
What is happening?
One point in time. No direction of inquiry. You have to look for exposure and outcome simultaneously. Okay? And if you want to look at the prevalence of disease, you have to think about the cross-sectional design. And cross-sectional design always generates hypothesis. Okay? Clear? No jargon. Disadvantage: you cannot infer the temporality, meaning that you cannot, from the cross-sectional design, it is not possible to determine whether exposure precedes outcome, whether smoking causes lung cancer. It is not possible. You can generate a hypothesis. Lung cancer may be associated with smoking, but you cannot be definite. Okay? It is not, you cannot confirm. Unless you design for the longitudinal. You have to look at, okay, this is the smoker, non-smoker. You have to follow them up some period and you can see how many are suffering from. So it is not possible from the cross-sectional design. Okay? This is the limitation of cross-sectional design. So it is, many bias may arise in cross-sectional design. It is not good for studying the rare disease. Not good for disease with short duration and high fatality. You have to remember, there is actually, it is not a question of understanding. But basic thing you understand for cross-sectional study design. Okay, clear? Cross-sectional design actually provides the descriptive value. Okay, what is the descriptive value? When you look at how many medical students smoke cigarettes, if your research question is like that, and what is the age and sex distribution of medical students who smoke cigarettes? So only describe how many students are smokers and how many of them are male, female, okay? And what is the age distribution? Whether if they are younger, they smoke more. Okay, this sort of description. When your study aim to look at this sort of descriptive value, then you have to design for that. Yes. It also gives you the analytical value. If you want to look at the association between regular cigarette smoking and scored among medical students. If you want to look at, okay, who are the regular cigarette smokers and how actually they perform the exam, that you can do. It is possible to do by designing the cross-sectional study. You can perform univariate and multivariate analysis, but it is not my business to teach you about the univariate and multivariate. It will teach you by Dr. Tai. And other cross-sectional survey means that if you, for instance, there is National Maternal Mortality Survey, National Health and Nutrition Survey. These always they design for the cross-sectional study design. These are the examples. The prevalence survey, any prevalence if you want to look at, then you have to use the cross-sectional study design. Okay? Cross-sectional study design always describe population characteristics. Meaning that, what does it mean? In terms of who are affected, where it is affected, when it is affected. Okay? For example, in nutritional survey, you want to look at you want to carry out a nutritional and health survey. You want to look at you choose an area or national survey, you want to look which age group actually eat what kind of food. Okay? And what is their characteristics? If their income is high, then what kind of food they are taking? This sort of question you always have to design for the cross-sectional study design. These are the descriptive questions. Okay? Any knowledge, attitude and practice study, you have to always think about the cross-sectional study design. Knowledge, attitude and practice of what? Of what? Any issue. What? Blood donation. If you want to look at knowledge, attitude, practice of blood donation of medical students, then you have to, any CAP survey, knowledge, attitude and practice, you have to design cross-sectional study. Then the management tool, the health service manager, the Ministry of Health and planners, they always use the cross-sectional survey to assess the utilization and effectiveness of services. The big national health survey, they always use the cross-sectional study design. These are the scopes where you can think about the cross-sectional study design. And cross-sectional study always helps you to develop the hypothesis. So there are repeated, I am using repeatedly the similar terms so that you can remember. You understand? At the end I will ask you, please mention 5 points in cross-sectional study. Okay? Finish cross-sectional study. Finish. You understand what is cross-sectional study? So your mini research which design you are going to follow? Why? Can you only one? Can you please speak and loudly so everybody hear and we can discuss? Anyone? You want? Yes. Can you please stand and so that you can everybody hear? You cannot. No, you can stand. There is no direction of inquiry. Okay, it's good. You hear? So case control study is under what category? Analytical, isn't it? So it means case control. If you have some cases, you also have some control. Why this? To compare. But in cross-sectional, there is no comparison group. But you can take comparison group. Then it becomes comparative cross-sectional. But I always told you the descriptive type cross-sectional. Okay? So in case control design, it is under the analytical study design. Okay? Here you can see a case control study compared cases. Who are the cases? Individual who have a specific disease of interest that you want to study. For instance, lung cancer. They are the cases. Compare with what? With a group of individuals without the lung cancer, without the disease of interest. That individual may suffer from other disease, but they cannot suffer from lung cancer. You understand? Huh? Okay? You understand? So, you have to case and control. Case is suffering from disease of interest. Control is suffering from other disease, but not the disease of interest. And you have to compare these two groups. You understand?
Yes.
And case control studies start with outcome and look backward for the exposure. We always start with outcome. Okay, lung cancer. We have to select the case and control first, then we have to go back to find out what is the causes for the lung cancer. So direction of inquiry is backwards. You have to go back. You have to look backward. You understand? So you have to select case and control first, then you have to inquire backward, go backward, and to look for the exposure. To find out what is the cause for the disease. You understand? So now you can understand what is the basic difference between cross-sectional and case control study, isn't it? And risk factors that is associated with the disease. But in case control, in cross-sectional study, it is not possible to find out the risk factor. Is it possible? No. Only it describes who are the people suffering from the disease, what age group is suffering from this sort of disease, okay? In which places it is occurred, like that. But in case control study design, you can identify the association between disease and causes, exposure. Understand? Clear?
Yeah.
If you do not clear, then you cannot understand my following slides. So clear?
Yeah.
Here an example I put here. To investigate the relationship between egg consumption and heart disease. You want to investigate the relationship between heart disease and egg consumption. Okay? So, you have to select the cases and control. So, a group of patients admitted in acid hospital with myocardial infection, you consider them as cases. Okay? And you ask them whether they consume egg. Okay? They were questioned about egg consumption. And then you control also, you have to select also control. Okay? How do you select the control? Without the disease. But you have to select the control from the hospital setting. From the same hospital. From the same hospital, but suffering from disease, but not with the myocardial infection. Because people who come to the hospital, they are suffering from disease. They are not a healthy person. Is it clear? And you also ask the control about egg consumption. Then you compare. This is the case control. Simple, but you have to understand. Otherwise, it will be complicated for you. Follow. You understand? Clear? Clear? Here is the diagram. So, in case control study, we have to select first the cases and control. Okay? Then we, here is the direction of inquiry. You have to go back. You understand? First you have to, but in cross-sectional study, what we do? We take a sample and we try to find out who are suffering from disease, who are not. But here, we select the cases and control. Then we have to go back and try to find out about the exposure. Exposure means you select the cases and go back and try to find out among the cases, some are exposed, some are not. You can see the exposure ball is bigger and the unexposed ball is smaller. You can see here. If you go back and control, some people are exposed, where majority are not exposed. You understand? So you initiate it here, then you go back and try to find out how many are exposed and how many are not from both cases and control. Then you have to compare. You understand now? So the direction of inquiry is backward. So what is the question then? What happened? Past tense, simple past tense. But in cross-sectional study, what is the question? What is happening? Present continuous tense. So you understand now from these two diagrams? Clear? Can I proceed? What is the advantage and disadvantage of case control study? Case control study is also very quick, inexpensive, and very small sample size is needed, and good for rare disease. Only one study design. When we study for a rare disease, we always design for the case control study. You have to remember. I may ask question in the examination about this. I want to carry out a rare disease. What design is the appropriate? Case control. Only one answer, case control. Okay? And good for disease with long latent period. Can estimate multiple risk factors for a disease. Because if you think about the previous diagram, if you select the cases and control, if you go back and look at the exposure, you have to find out you have to find out the main exposure variable, and at the same time you have to find out the confounders. That will teach you yesterday a little bit, but I will teach you subsequent classes on confounder one day. Okay? And what is the disadvantages? Prone to bias. Bias means, you know bias.
Yes.
So there might be many biases, particularly the recall bias, because you want to go back. So patient may forget many things. That's why, particularly the recall bias. But it is also possible to how to minimize those bias. I will teach you in one class. There is bias one day. Okay? It is not possible to measure the incidence from the case control study. Incidence we always design for the cohort. I will come a little bit later on. There are three basic design you have to understand: cross-sectional, case control, and cohort. Okay? So if you want to look at, if you want to measure the incidence, what should the design? So cross-sectional is not cross. Cross-sectional cross, case control cross. You understand? For prevalence study, which design is appropriate?
Cross.
Okay, then difficult to measure. It is also difficult to determine temporality, whether exposure precedes the outcome. Temporality means whether exposure precedes the outcome. It is not possible to determine in case control. Why? Because we are going back. At first we select the case and control, then we go back and look at try to find out what is the exposure. If you select the exposure first and go forward, try to look at how many disease and how many outcomes are coming out from the exposure. Then exposure precedes the outcome, isn't it? So it is not possible here. Because you select case and control first, then you have to inquire backward. So temporality is not possible here. You understand? There is a basic difference. Clear? And not good for rare exposure. Good for rare disease, but not good for rare exposure. Good for rare disease, but not good for rare exposure. Please remember this. Very, very basic thing. Okay? So, steps of case control study. At first, you have to have a hypothesis. Without hypothesis, you cannot design a case control. What kind of hypothesis you have to have? Yes, you can test hypothesis. But there should be an hypothesis. Then you can test hypothesis. And hypothesis can be generated from cross-sectional descriptive study, case series, okay? And once the hypothesis is developed, then you have to test the hypothesis using either case control or cohort. Okay? So you have to have the hypothesis. Then you can test the hypothesis using this design. For instance, smoking may cause lung cancer. May. There is probability. You are not sure. And this is generated by the cross-sectional study. And now you want to test. Okay, then I have to lung cancer. So I have to select some patient with lung cancer, patient without lung cancer. Then I have to go back, inquire backward, and look at how many are smoker in each group. then I have to compare. If in my statistical test show that smoker, yes, I will tell you the later slides. Smokers, among the cases there are more and more smokers, and of course you are sure that smoking is associated with lung cancer. Okay? So you have to have a hypothesis. Hypothesis is smoking may cause lung cancer, may cause. And once you test it, then you can conclude smoking is associated with lung cancer. But previously you say that smoking may cause lung cancer. But your conclusion after this conclusion study is smoking is associated with, not may. Now you are confirmed. You understand? So you have to assemble the appropriate comparison group also. You understand? And you have to have certain definition of cases and control. And you have to have certain selection criteria, both cases and control. Inclusion and exclusion criteria. What are the criteria you want to include and what are the criteria you want to exclude? Okay? And you have to select the control, then determine the exposure status. You know that which one is the exposure status for lung cancer smoking. So you have to have which might be my main exposure variable. So you have to determine earlier. And sometimes we prefer to match case and control. I am coming every point. So a successful case control study should be clear-cut and unambiguous definitions. There should be no zigzag, no may, no might. That this is this, this is this. You have to be very clear. And there should be unbiased selection procedure, and it should be well thought way of measuring the exposure. These are the points you have to remember. So one thing is important. You have to select the control very carefully. You have to define both cases and control. You have to decide earlier which one should be your main exposure variable. Okay? Clear? So now, how do you select cases? How do you become 100% certain? 100% certain that it should be your case. So in case control studies, selecting a case and control is very important. You understand? So in order to 100% ascertain that your case is like that, so from where you need to select the cases? From where? Hospital record. Because in hospital, doctors diagnosed case. That's I told you also in my mini research class. Okay? So then you 100% ascertain that your case is lung cancer. It is not possible. So no ambiguity is there. So you are certain, 100% certain. Okay? And if you want to 100% certain, then case registry. For instance, if you want to study on cancer, then you can take the cancer cases from the cancer registry. Okay? Any case registry. No. Physician's registry, physician office record, because they have the registry. You can use hospital admission visitors record, pathology department logbook. These are the things you can use to select the cases. You understand? Yes. So ideally cases are a random sample of all cases of interest in source population. So if you, for instance, after sample size calculation, you find, okay, 50 cases enough, 50 lung cancer cases enough for you. But you want to look at in 2008, in 2008 you go to the hospital, cancer hospital, and you find in 2008 there are 100 or 120 lung cancer cases over there. But you need only 50. Then you have to randomly pick them up. Okay? Here. You don't need to include all 120. You randomly pick only 50 cases. Then selection of control. Actually, main challenge is the selection of control. Okay? Appropriate control group. That is most difficult and most critical issue in case control studies. Who is the best control? Where the control comes from? Who should be the best control? Huh? Point we noted. If cases are a random sample of cases in the population, then control should be the random sample of all known cases in the population, sampled in the same time period. For instances, I give you the example. If you go to the hospital, cancer hospital, in 2008, you want to look at in 2008. If you need 5 cases, lung cancer, then you took the 50. And you took randomly 50 lung cancer cases. In the same hospital who are not suffering from lung cancer, you take 50 control randomly on 2008. Not in 2007 or 2010. You understand? Yes. So this is very important. If you take the cases from hospital, you have to select also the cases from hospital. If you select control from the population, then you have to select control also from the population. If you select cases randomly, then you have to select control also randomly. So same selection procedure. Okay? So usually it depends on which population you are studying for. Who are the sources of selecting control? General population, random disease, diarrhea, neighborhood, blah blah blah. So there should be 3 qualities in control. Comparability is more important than the representativeness in selection control. So you select 50 cases, you have to select 50 control. You can select 50 control from anywhere. No. Comparability is important, not representativeness. Okay? So you have to have certain criteria. And control also should be at risk of the disease. You take the lung cancer, you are going to look at the association between lung cancer and smoker. So who are the not suffering from the lung cancer, they also should be at risk of exposure. You understand? And who should be at risk of the disease? Okay? So that patient may also, anytime they can also suffer from lung cancer. Control should be resemble the cases in all respect, except for the presence of disease. Resemble means similar. Control should be similar with the cases, except one criteria, without the disease. Easy, very easy. But you have to remember certain points. Number. Representative means the number. For instance, if you select 50 cases, you have to select 50 control. Comparability is important rather than the representativeness. Comparability means if you select cases from hospital, you have to select control also from the hospital. But you cannot select because your control is without suffering from the particular disease. So you can select them from the population also. You cannot do that because you are selecting your cases from the hospital. So you have to select the non-cases from the hospital also. This is the comparability. So both people are sick. They came to the same hospital. One suffering from lung disease, another suffering from other disease. Do you understand now? This is the comparability. But you take both 50-50. 50 cases, 50 control. This is representative. When the number is okay, but you have to keep, the more important thing is comparability. You understand? Yes. What happened? It is not working. Okay. Now, what proportion of cases and control should be there? Usually, in population, control is more than the cases. Okay? So, for each case control group, for each control group, how many control per cases should be? What is the ratio? Standard ratio is 1:1. But if you have small number of cases, then you have to consider the ratio 1:2, 1:3, 1:4. You understand? To increase your sample size. Sometimes in rare disease, you cannot get no, not the cases, sufficient amount of cases according to your sample. So in order to meet the sample size, you have to, there is no choice, then you have to increase your control group. Because there is no cases. How do you get case? It's not possible for you, isn't it? But up to 4, we always, statistical standard is up to 4, not more than this. Question? Case control study, we always think about the matching between cases and control. Okay? The matching variable, for instance, is the ages, matching criteria within the same 5 years of the school must be set up in advance. During design, you have to think about the matching, not afterward. For instance, if you want to select the cases for 20 to 40, then you need to select the control also within 20 to 40 years. This is called matching. Because both case and control are matched with the same age group. Okay? You understand that? And that should be, it should be set up during designing stage. I told you that because when we have less number of cases, then we have to increase our control. Okay? And it is important to remember that up to 4 cases, up to 4 control, 1:4, not more than this. Because why we increase cases? Because in sample size, today Dr. Jamal will deliver a lecture, there is always a question of power of sample size. In order to meet the power, actually we have to meet the adequate number of sample size. So if you have less sample size, after statistical, because statistical calculation give you the number of the sample, how many sample you require for your study design. So for calculating sample size, there is power and many things. You can learn today in the afternoon. Okay? So in order to meet the adequate power, we have to meet the adequate sample size. That is derived from the statistical calculation. Okay, so up to 4, power can be increased. If you take 5, no need. No, it is actual power cannot be increased after that. So it is useless. You have to remember this. Okay? It's not essential, but it is important to remember. So there are many kinds of bias can arise in case control study. Confounding bias, selection bias, recall bias, interviewer bias. I have a class with you on bias. In that class, I will discuss more on the bias, not today. But it is remembered, this sort of bias may arise in case control study. And this is important for you. In case control study, the only measures of association, only the measure to look at the association, because you always want to look at the association, isn't it? Association between exposure and disease outcome. So odds ratio is the measure of association. You have to calculate the odds ratio. So this is odds ratio is a measure of association that is used to quantify the strength of association between the, what is the strength of association between the exposure and the outcome. Okay, you understand now? So odds ratio is the measure of association that typically quantifies the strength of association between exposure and outcome period. And odds ratio, what is the odds ratio? Odds ratio is a ratio. Ratio between what? Between the odds that the cases are exposed and the odds that the control are exposed. These two ratios. Odds that the case are exposed, odds that the controls are exposed. I am coming. Here. So you studied, you can see here the cases and it is controlled and some exposed, some are not exposed, isn't it? So what is the odds that a case is exposed? Case A divided by C. So total cases, how many cases are exposed? Total is A plus C, isn't it? So odds that case is exposed A divided by C and odds that a control is exposed, that is B divided by D. So ultimately AD divided by DC. You understand now? Clear, this is important for you. Very, very important. Odds ratio and relative risk. For case control study, only the measure of association is odds ratio. Okay? And it is the ratio between the odds that a case is exposed and the odds that a control is exposed. So this is the 2 by 2 table. And you can see here A divided by C, B divided by A divided by C. So I created this table because it is easy to understand for you. You understand now? Yes. Simple mathematics. Isn't it? Okay. So now this example. You know, patient with lung cancer, case and control. Okay? And control with other disease. That means the control without the lung disease. And here the smoker. Your exposure is smoker of 40 to 24 cigarettes per day. This is the main exposure variable and non-smoker. So you can, this is the 2 by 2 table. And what should be the odds ratio? 1, please. What should be the odds ratio? I do not want to know. What should odds ratio equal to? What is? How? What? You calculate it? Everybody has the mobile, isn't it? Anyone? Not yet. Yes. 9.6. Okay. Yes. Correct. It is indeed, isn't it? AD by BC. You understand now? Understand? Clear? Now, interpretation of odds ratio is important. If odds ratio is 1, what does it indicate? It does indicate that odds of exposure among cases are the same as the odds of exposure among control. So there is no association. It's the same. You understand? If odds ratio is more than 9, you got 9.7. It is more than 1, isn't it? If it is more than 1, then it denotes that odds of exposure among cases are larger than the odds of exposure among control. So it is the risk factor. Risk factor. You understand? If it is less than 1, it denotes that the odds of exposure among cases are smaller than the odds of exposure among cases. You understand? If it is smaller, then it is not risk, it is protective. It protects you from suffering from lung cancer. You understand? Very interesting. 1 means no association. If you get 1, there is no association between lung cancer and smoking. If it is more than 1, then lung cancer is a risk factor for no. Smoking is a risk factor for lung cancer. If it is less than 1, but smoking never isn't it? Never protect you. So, if this is a quiz for you. You want to look at the factors associated with neonatal death. Who will be the cases here? What? Who would be the cases? I am not going to understand. Only one can. Raise your hand and tell me. No? Huh? Who would be the cases? I want to look at the factors is associated with neonatal death. Yes, dead neonates. They are the cases. And who would be the control? Live neonate. Or mother. No, you can ask the mother. But your case is the neonate, dead neonate. And control is live neonate. In the same year. Be remember, same year. Okay? And where from we correct the control? If you take the cases from hospital, then you can take the control also from the hospital. Now the cohort, okay? Cohort. Oh, there is no time. Cohort always try to find out what will happen. So, future, simple future tense. In cross-sectional, we use what is happening. And in case control study, we question what happened. Here, what will happen. So, very basic and very easy to remember, isn't it? What will happen. And perspective. Perspective means moving forward. Moving forward, not backward. Okay? Backward means retrospective. Prospective means moving forward. And moving backward is retrospective. Because these two terms will come frequently. Retrospective and prospective. And obtaining data on exposure. So you have to have the exposure first. I am come to the diagram again. I am coming to the diagram, then it will be easier. But you have to have some information on the exposure first. Move from exposure to effect. So you have to have exposure first, then you have to follow them up, move forward, prospective, to see the status of outcome. Understand? And you have to study on a cohort sample. What is cohort? Cohort is a defined group of population without the disease, but with some exposure, non-exposure. But in cohort, healthy, you have to select the healthy people. What does it mean by healthy people? They should not be suffering from the disease of interest. You understand? They may suffer from other disease, but not the disease of interest. You understand now? Now, the same diagram, but you see here, at first we select the cohort, okay, for the study. In this cohort, there are some people who are exposed and some people who are not exposed, but they are not suffering from any disease. Then you have to follow them up. Your direction of inquiry is like that. You understand? So this is the direction of inquiry. Now you have to select sample. In sample, there is some people who are exposed and some are not exposed. So you have to follow them up for a certain period. It depends upon, I do not know, it depends upon what disease you are interested in. It may take 1 year, it may take 2, 5 years, sometimes it takes 10 years. We do not know. Follow them up to find out the outcome of interest. So you can see here, subjects who are exposed, there is some portion who you can see with outcome and some without outcome. You understand? And also same, some with outcome, some without outcome. Then you have to compare. You understand that? But in cohort study, case control, we move backward. We first select the cases and controls. Then we go backward, isn't it? This is the main difference. So direction of inquiry is forward, prospective. You understand? Everybody clear? Okay. When we design for the cohort study, when there is good evidence of association between exposure and disease, they are derived from clinical observation supported by the descriptive or case control study. Because if you have to have some assumption, the smoking may cause lung cancer. But in order to see the association, cohort study give you 100% you are certain. 100% you are certain that yes, smoking causes lung cancer because you follow smokers and non-smokers at the same time and follow them up for 10 years. And at the end of 10 years, you can see how many people are suffering now from the lung cancer, how many are not. So you are more ascertain compared to the case control study. But we practically actually we do not consider the cohort study. Why? It is very good study, but in long period of time, much money we need, it's very expensive. That's why we use the case control study. You understand? Practically it is not possible all the time. That's why. You understand? But if you look at if your intention is to see the causal association, we always prefer standard design is the cohort design. Okay? But in most of the cases we are unable to do that because of it needs much money, longer time, you have to wait 10 years. It's quite long time. Isn't it? But if you design the case control, it takes only a few months, 1 year. Because already there is outcome. Now you look backward, take records and asking questions about that and analysis and find out. You understand?
Yes.
Practically it is quite difficult. Okay. And it is indicated when exposure is rare. Because in case control study I told you, when exposure is rare, we cannot design case control. But in rare disease, the best study is the case control. And if the exposure is rare, the best study design is cohort study. You understand? And when follow-up is, because you have to follow them up 10 years, 5 years. If the follow-up is not easy, then it is useless case control, this sort of study design. You have to have good follow-up pattern. So what is the advantage? Advantage of cohort study can estimate multiple outcome of exposure, less prone to bias. Very few biases here because you follow the exposed group and unexposed group. And it is possible to find out the temporality. So you can conclude that exposure precedes the disease because you follow the exposure. You follow the lung cancer. So you are 100% certain. Lung cancer causes that. Yes. But in case control study, your conclusion is lung cancer is associated with smoking. But in cohort study, your conclusion is lung cancer causes disease. So causal association. Understand? Understand? Different terminology we are using, but meaning is the same. The terminology is different. Okay? And good for rare exposure, and only this study can measure the incidence. No other study. Disadvantage is costly, large samples needed, and time consuming. Not good for rare disease, and loss to follow-up is very common, and it is very important. If there is many loss to follow-up, then it is a threat for the study. So you have very careful. You have to be very careful and very expert epidemiologists are needed for that. So, in cohort study, the measures of association is relative risk. In case control study, measures of association is odds ratio. So, relative risk is the ratio between what? The risk of disease in exposed individual and the risk of disease in unexposed individual. I am coming in. And it is calculated by dividing the incidence rate of disease in exposed group by the incidence rate of disease among non-exposed group. You understand? Now you understand. That's why I prefer the diagram. It is very easy to understand, isn't it?
Yeah.
So you know the relative risk. Because you follow both exposed and unexposed group. So at the 10 years you can see how many suffering from the disease in exposed group and how many from unexposed group. So you just divide them. Understand? So what is the what should be the interpretation? If it is the same as odds ratio. So relative risk 1 means the risk in exposed group is equal to the risk of in unexposed group. Risk of developing disease in exposed group is equal to the risk of developing disease in unexposed group. So it is equal. So no association. Okay, no risk. If odds ratio equal to risk, relative risk equal to 1, then no risk. Okay? Or no association. If it is more than 1, it denotes that the risk in developing disease in exposed group is greater than the risk in developing disease in unexposed group. So, positive positive association and it is causal. Okay? So there is risk. And if it is less than 1, then risk of developing disease in unexposed group is less than the risk of developing disease in unexposed group. So it is negative association and positive protective. Same. Also and here is the same. Understand? Now, for you. So, if the scenario is Japanese bee encephalitis is a disease, okay? It's a common disease or rare disease? Huh? Common disease. You hear about Japanese bee encephalitis? Commonly? Very rare. So you have to have an idea which is the common and which is rare disease. Okay? So please concentrate on this. And if you have any question, I do not have much time. Question, please raise your hand and ask me. Japanese bee encephalitis is being sporadically reported from a region in Malaysia. You are asked to develop a research protocol to have some epidemiologic idea about the disease for further research issue. What type of research design you may plan initially and what? Initially and what?
Is being sporadically happening.
No idea. What they want to look at?
Something that's happening.
What is the aim? Epidemiologic idea. What is the epidemiologic idea? Prevalence and what time it has occurred, in which population it is affected, which place affected, which kind of question it is. Descriptive, isn't it? So it is very important to understand the question first. What is the aim? What is the objective of your study? You understand? Yes. When I say then yes, when I ask question, how do you understand? If you do not respond? So, what type of study design? Because their aim to know some epidemiologic idea. Epidemiologic idea is time, place, person. 5W. I told you yesterday. 5W. What? When? Where? Who? So, descriptive study is rare and sporadic disease. Aim to get, because your aim to get the epidemiological idea. You are not going to look at any association. You are not going to find out any associated factor, any causal factor. You want to know some epidemiological idea. That's why your design should be descriptive. You understand? Everything is understand, but you cannot respond. And from here, hypothesis can be formulated. Then you can design for other study. Case control or cohort or something like that. But as your aim is to find out only the epidemiologic idea, then that's why your design should be descriptive. 5W. You understand? Second scenario is low birth weight is very common in our community, causing lots of morbidity and mortality among under 5 children. Okay, you understand? You are asked to find out possible risk factors for the development of low birth weight that may help intervention plan to decrease problem burden. What is the aim? I cannot understand anything. If everybody talks, then no one talks. What's the aim? Can you please raise your hand and say something about the aim? What is the aim of the study? Yes? Yes, to find out the possible risk factor. You are asked to find out. So this is the aim. Then, what type of design will be most appropriate and why? Yes, why? Case control study, but why? Because you know here the outcome. Then you have to go back because outcome is here, low birth weight. And your intention is to find out the risk factor of low birth weight. So status of outcome is known here. And your intention, your aim is to find out the risk factors for low birth weight. So that's why your design should be case control. You understand? These are very basic things. So here's the answer. So you know the disease status, you have to look back. You have to look backward. The direction of inquiry is backward for the exposure, isn't it? And that you told me. Let's first, and your aim is to identify the risk factor of low birth weight. Another, then it's finished. Yes?
The question for that we know that the case control study is suitable for the rare disease, but before that the case is common. So why is it that we can use the case control? I'm very confused why we can use the case control, because we know that case control is good for rare disease.
Good for rare disease, because for the rare disease we always prefer the case control design. But you have to know, in the previous example, the low birth weight status is known. Your outcome is there. And your aim is to find out the risk factor for the low birth weight. What is your aim? That's why you have to, because you cannot design here the cohort. Because your here the outcome is already known. You understand? That's why you have to design for the cohort, case control. Because case control outcome is known, you have to go back, your direction of inquiry is backward, and you have to find out the causes, exposure. You understand now?
So can you say that regardless they are rare or common, we can use the case control method?
No, it depends upon your objective. Depends upon your objective. Because in first example, I gave the sporadic disease. What? Japanese encephalitis. It is a rare disease. But we designed for the descriptive study. Why? Because your intention is to find out some epidemiological idea. 5W. You understand? So, your objective is very important. What is your aim of the study? Please don't discuss among yourselves. If you do not understand, raise your hand. You understand? Yes.
Regarding the cross-section lens, it study the prevalence and also the factors at the same time, the exposure and outcome. So is it just descriptive or also analytical?
Which one?
The first
Yes.
is it descriptive only or it can also be analytical?
It is descriptive. Descriptive. Analytical, if there is analytical means that it should not be the case control and cohort, but comparative cross-section is possible, but there is no comparison group. Okay? You understand that? So, purely description. So, here another example, then I finish. Okay? So, in a village in Kuantan is reported to have high prevalence of diarrhea. So, high prevalence of diarrhea. And people living in the area are using tube well water, tap water and bottled water for drinking purpose. Okay? You are contemplating that people using tap water are more prone to develop diarrheal disease. Your hypothesis is yes, more prone. You do not know, but your assumption. So how many types of study design you can? How many types of study design you may think on this? What? Yes. What to type? Cohort and response. Okay. Any more responses? Why cohort? Okay. Yes. And case control? Why case control? Very good. She is very good. Okay, she understands. She understands. But the first answer is you can design for 3. So, cross-sectional design is also possible. Okay? In this scenario, how? You have to go to the village, respective village, and interview them on whether children had diarrheal episode in last month or so on, and about the source of drinking water, then compare. This is cross-sectional. Just go to the village, ask them. You have to find out what is the prevalence of diarrhea and ask them which source of drinking water they had in the last month or and so on, and you have to compare. This is the cross-sectional design. And you can also consider the case control because diarrheal usage is known. You know who are suffering from the diarrhea, and you have then children attending the nearby. How can you select the cases? Because who suffer from the diarrhea, they go to the nearby hospital, isn't it? So children attending the nearby health facility for diarrhea and those attending for the vaccination. Diarrhea is the cases. And control should be the children without diarrhea. So how can you find out? Because you are selecting the cases from the hospital. So you have to select the control also from hospital. How do you find that? So you can take the children who go to the facilities for vaccination or other diseases or other reasons. Then you can select them the control. And ask them retrospectively, what is the source of drinking water they have used? This is also possible. Cohort also possible. How? Children will be identified as part of the drinking water who used to drink tap water, who used to drink tube water, who used to drink bottled water. Then you have to follow them up. Is it? So 3 designs are possible. You understand? Okay. So this is the basic thing. I always told you 5W, 5W, 5W. So what, who, where, when, which? When this 5W, you want to get the answer on this 5W, you have to design for the descriptive. If there is 2 addition, how and why, then you have to think about analytical. Okay? So this is very, very basic things and essential. I expect you to remember. Isn't it? So selection of study design depend upon the problem, knowledge about the problem. This is the Thank you. Okay? You understand? If you have any problem, come to my room at any time, no problem. Okay? Please take care. Lisa has something to do. Okay? She's here.
Seventeen Understood?